Today, I want to talk about stem cells and Hashimoto's disease and how Hashimoto's actually affects a lot of people. It's called an autoimmune disease. And my background is, again, I'm a chiropractic physician and I'm also an acupuncturist as well. I received my doctorate when I was 24 years old. I was a refugee from Vietnam, and you can actually go onto my website and click on my bio link and learn a little bit about me. And I really love educating the public and my community about health and wellness because that's what we're about. So let's begin. So what are hormones? Hormones are actually, they're chemical messengers that they have a huge impact on your body. And they travel throughout your blood and they cause these changes in your organs and also in your tissue. They work in a lock and key fashion. So what parts of your body does your hormones actually affect? The answer is everything. Your hormones affects your brain, your thyroid, your adrenal glands, your whole entire body, even your joints and your muscles as well. So today we're going to be covering the thyroid hormone. And the thyroid is this little butterfly gland that sits right around your neck, your throat. So we talked about the 14 signs and symptoms of Hashimoto's disease, which is a thyroid imbalance, a thyroid dysfunction, an autoimmune disease. Fatigue, sluggishness, increase in your sensitivity to cold, constipation, pale skin or even dry skin, puffy face, brittle nails, hair loss, or even enlargement of the tongue. That's affected by your thyroid, by the way. Unexplained weight gain, and this is kind of like depressing because you can duct tape your lips and that scale is just not going to move. Muscle aches and pain, also joint pain can be one of those signs and symptoms of Hashimoto's disease. Excessive or prolonged menstrual bleeding, depression, and also memory lapse. And here's the scary stuff. This is the stats on autoimmune diseases. Approximately 50 million Americans are affected by some type of autoimmune disease. That's 20% of our population. That means 1 out of 5 people are affected by an autoimmune disease. And here's the really, really scary part. Women, more likely than men, are to be affected. So 75% of us women are affected by this autoimmune disease. That's like 30 million women. So what is Hashimoto's disease? It is an autoimmune disorder that affects your immune system. And it attacks your thyroid. And it is the most common cause of what we call hypothyroidism. But you go to your doctor and your doctor check your thyroid and the thyroid is fine. Your doctor say, hey, your thyroid's okay. And you're like, okay, I'm so glad I have that news that nothing is really happening to me. And then you go out into your car and you're driving home and you're thinking, oh my gosh, my hair is like falling out and my nails are so brittle. I just don't feel right, but the doctor said everything's okay. So then you think it's all in your head, and I'm here to tell you it is not. You live in your body and your body is trying to tell you something. So when we talk about looking at the root cause of a problem, we want to make sure that the appropriate test is being run. So your thyroid, your brain sends a message to your thyroid gland, and your thyroid gland makes what we call T4, which is the inactive form of thyroid, and T3, which is the active form of thyroid. So T4, inactive, converts to T3 in your gut and in your liver. So what causes our hormones to be out of whack? Of course, this did not occur overnight. So anytime when we talked about autoimmune disease or anything like that, we're talking about it's multifactorial. So that means that there's multiple things that can cause your hormones, especially your thyroid, to be out of whack. Number one is your environment. Number two can be your genetics. Number three is your lifestyle. So when we talked about the inability, remember, to convert T4, inactive form of thyroid, to T3, active form of thyroid, is aging, alcohol, diabetes, fluoride, chloride, bromide, mercury, stress, also obesity can cause that imbalance. So if you remember chemistry and you pull up the periodic table, in a periodic table we have fluoride, chloride, and bromide, which sits all the way on top. We call them halogens. So they compete with the receptor cells of your iodine, which is needed for your thyroid to function properly. So Hashimoto's disease is also known as thyroiditis. That means it's the inflammation of the thyroid gland, aka chronic lymphocytic thyroiditis. The reason why hypothyroidism occurs in Hashimoto's disease is because of tissue degeneration. Degeneration means to break down. So your body's antibodies are actually destroying your thyroid tissue, and it causes an increase in your risk factor for developing other autoimmune diseases. Our three-step process is, number one, we want to make sure we measure. Number two, we want to make sure we analyze. And number three, we want to make sure that we plan out your treatment plan or your treatment session. So with our medical team, what we notice is the following therapies actually help to keep Hashimoto's disease in what we call remission. So of course, dietary changes plays a huge role in keeping everything at bay. So instead of going out and getting all these extensive and expensive food sensitivity testing, I would start out with like just 3 simple things that anybody can follow. So number one, eliminate gluten. Number 2, no dairy. Number 3, no corn. Again, no gluten, no dairy, no corn. And just stay away from it for about 3 weeks and see how you actually feel. And number 2, another thing that we usually use in our medical facility is called low-dose naltrexone. Low-dose naltrexone, again, is called low dose. The prescription form of naltrexone starts out with 40 milligrams. But what we want to do is that we implement week number 1, 1 milligram. Week number 2, increase it to 2 milligrams. Week number 3, we increase it to 3 milligrams, just to keep the autoimmune at bay. And then the third type of therapy that is like regenerative medicine, it's called stem cell therapy. So a lot of you guys heard about stem cell therapies, and there are different types. So let's just kind of like start from the very basic. So what are stem cells? Stem cells are actually your body's internal repair system. So what do stem cells do? They actually seek out degeneration, they build, repair, and they create new tissue. So stem cells are also what we call anti-inflammatory. They are very effective in reducing inflammation. They are what we call immunomodulatory. So they actually helps to modulate your body's immune system. And so what I did was I wrote a very simple 35 page book. It's called Stem Cells Made Simple. And at the end, we'll make sure that we send you a little link on the bottom comment section, right, team? Yes? Okay, and then you can click on it, and actually you can just download my Stem Cell Made Simple for free. Stem Cells Made Simple book. It's an ebook. So let's go back to Hashimoto's and hypothyroidism a little bit more. So if left untreated, hypothyroidism from Hashimoto's disease can cause other health problems, including infertility, possible miscarriage, possible birth defect, and also high cholesterol. So proper testing again is key. And we want to go through a 3-step process. Number 1, we want to measure. We need to establish a baseline. My patients can feel absolutely amazing, but I really want to see it on paper as well. And we actually able to track this by the cases that we see at our medical facility. And number 2, we analyze. Our medical team is trained to analyze what we call these optimum levels. And number 3, we plan out an action plan for you. So these take-home keys are really, really important. So Hashimoto's disease can occur in both men and women. And 1 out of 5 will have some type of autoimmune disease. 75% of that group are women. Managing Hashimoto's disease is not a one-size-fits-all approach. So we have to look at the whole body as a whole entire unit. And it's so important for you to get tested. Ordering the right kind of blood panel is so important. And make sure your healthcare provider is listening to you. You know your body best because you live in it. Our job as a physician is to kind of figure out what the root cause of your symptoms are. Why are you feeling the way you're feeling? And what I would love for you to do is just schedule your appointment, and then when you come in, we'll sit down, we'll have a conversation and see where do we start. So what you can do is click on the link below and fill out the required information which my tech team put together. And I'm gonna allow my staff to be able to what we call set up your consultation and to reserve your spot. Make sure you put down a $50 non-refundable fee, because what we want to do is that we want to secure your time. I'm actually pretty busy, so I want to make sure that we're able to fit everybody in. And we'll sit down and we'll talk and we'll measure and we'll plan and see what we need to do to get you started and to get you feeling better again. Well, thank you so much, and I'm gonna again say bye and make sure that you place a comment below, and then we'll start from there. Thank you.